I want to thank everybody for joining us today to talk about the Vulnerable Road User Safety Assessment Guidance. The guidance was published on Friday, October 21st, and is now available on the FHWA Office of Safety website. And this webinar will help walk through the guidance. Next slide. As with any of our guidance documents, we have a standard disclaimer that applies to presentations. So, except for any statutes or regulations cited, the contents of this presentation do not have the force and effect of law and are not meant to bind the states or the public in any way. This presentation is intended only to provide information regarding existing requirements under the law or agency policies. Next slide. FHWA was required by the Bipartisan Infrastructure Law, also known as Bill, to develop guidance for states to carry out the VRU safety assessments no later than November 15th of this year. So we're excited that we were able to meet this requirement ahead of schedule. We were also required to consult with the states and relevant safety stakeholders in the development of the guidance. So we held multiple listening sessions to get input from customers and stakeholders, and also sought feedback from the states at the AASHTO Committee on Safety meeting earlier this year. We also reviewed input from the Bill Implementation Federal Register Notice specifically related to the VRU safety assessment and considered all relevant feedback in the development of the guidance. We're now going to walk you through the guidance document. There are five main sections, beginning with the purpose, some definitions and background, and then the guidance, which is basically the meat of the document. This is followed by contact information in case you have any questions, and a template for the VRU safety assessment is also attached. Next slide. The purpose of the guidance is to clarify the requirements for the VRU safety assessment. All states are required to develop an assessment as part of their HSIP. Please note that this requirement is different from the Vulnerable Road User Safety Special Rule, and it applies to all the states. Next slide. Bill introduced 3 definitions under the HSIP that are specific to the VRU safety assessment, and those definitions are included in the guidance for quick reference. They include definitions for the safe system approach, the definition of vulnerable road user, and the definition of VRU safety assessment. I do want to take a minute to discuss the definition of VRU specifically. For purposes of the HSIP, the definition of VRU refers back to the definition in the Safety Performance Regulation, which defines a non-motorist as a pedestrian, a bicyclist, other cyclists, and person on personal conveyance. Please note that this definition is unique under the HSIP and does not include motorcyclists, which differs from the NHTSA definition, which does include motorcyclists. These are important distinctions to keep in mind as you're reviewing your safety data and identifying strategies to improve the safety of VRUs. Next slide, please. The background section of the guidance emphasizes the importance of the assessment as it relates to the increasing number of vulnerable road user fatalities on our roads, equity and climate change, and sustainability. It also encourages states to prioritize vulnerable road user safety in all investments and projects, including advancing complete streets activities and related design policies. This will be covered in more detail in the next 4 slides. Next. The next slide, please.
Are the slides advancing?
Yeah, now they are.
Okay, sorry. Okay, thanks.
As you can see here, VRU fatalities are trending up, and early estimates from NHTSA from 2021 indicate that the total projected pedestrian fatalities increased by 13% from 2020 to 2021. And bicyclist fatalities increased by 5% during that same time period. And I think we can all agree that this is unacceptable, and we need to make drastic changes in how we design, build, and operate our roads to change these trends. Next slide. To do this, we encourage all states and other funding recipients to prioritize VRU safety in all federal highway investments and in all appropriate projects. This is consistent with the Safe System approach, which addresses the safety of all road users, including those that walk, bike, drive, ride transit, and travel by other modes. It involves a paradigm shift to improve safety culture, increases collaboration across all safety stakeholders, and refocuses our transportation system design and operations on anticipating human mistakes and lessening impact forces to reduce crash severity and save lives. To achieve our vision of zero fatalities, VRU safety should be fully considered in a state's transportation investment decisions, from planning to programming, environmental analysis, project design, and construction and maintenance and operations. Next. This guidance also emphasizes that fatalities impact communities differently, particularly for people not in a vehicle. As you can see here, bicyclist and pedestrian fatalities are overrepresented for American Indians, Black and African Americans, Hispanic and Latinos, compared to total bicyclist and pedestrian fatalities. States should ensure that their VRU safety assessments address equity by considering the impacts to these communities in both their data analysis and public engagement and consultation efforts in those areas that are identified as high risk, particularly for those where VRU fatalities and serious injuries are overrepresented in these communities. Next slide. We also encourage the advancement of projects that address climate change and sustainability. Consistent with our administration's priorities, this is especially relevant to the VRU safety assessment. Since projects that encourage increases in walking, biking, and rolling trips, including VRU safety projects and strategies, will also help reduce greenhouse gases. Projects that support fiscally responsible land use and transportation efficient design also encourage increases in walking, biking, and rolling trips. We also encourage recipients to consider projects and strategies in the VRU safety assessment that address our environmental justice concerns to ensure the needs of all road users are met. Next slide, please. The main section of the guidance is organized into 4 sections, and those sections include information about the schedule and frequency of the vulnerable road user safety assessment, the requirements for the content of the assessment, potential funding opportunities for both the development of the assessment and implementation of the resulting program of projects and strategies, as well as the relationship to other HSIP and vulnerable road user activities. And at this point in the presentation, I'm going to turn it over to Kelly Morton.
Thanks, Tamara. That was Tamara Redmond. My name is Kelly Morton. We're both with the Federal Highway Administration Office of Safety at headquarters, and happy to be here today to share an overview of the guidance with you. So I'm going to take it from here. And Matt, next slide. We're going to jump into the meat of the guidance, which I know you're all very interested to hear about. So in the first section of the guidance discusses the terms of the schedule and the frequency of the assessment. All states are required to complete a vulnerable road user assessment by November 15, 2023. And include it as part of their strategic highway safety plan. States can include the assessment as an appendix to the strategic highway safety plan, which can be added to the actual SHSP document, or it can be included as an addendum or as a separate, meaning a separate document. If it's included as an addendum, it would still need to be approved by the governor or the governor's designee and posted on the website with the SHSP, consistent with the SHSP approval process requirements. We want states to actually use the assessments to make a difference in achieving the long-term vision of zero fatalities. So states should focus on implementation and using the outcomes of the assessment to prioritize vulnerable road user safety assessments in their investments in their states. So this is not a one-time assessment effort. States are required to update their vulnerable road user safety assessment with their update cycle and subsequent SHSP updates, which happens at least every 5 years. So we recognize that all states are on different SHSP update cycles, and we have allowed in the guidance that states can publish their SHSP update in the year that, if a state is publishing their SHSP update in the year that follows after the assessment is due, we're allowing for 1 year that the state can update the data or at least confirm that the data is still current and if there are no changes to their initial assessment. And then include the assessment as an appendix to their SHSP. So I'll emphasize this is only based on the date that the SHSP is published. So I'll repeat, if before November 15th, 2024, those states can confirm there have been no substance updates to the information in their initial assessment, then they can say that it's still current with their SHSP update. And again, this is only for states that publish an SHSP update before November 15th, 2024. If your state's next SHSP update after the completion of their initial assessment is published after 2024, then it's expected the state update the vulnerable road user safety assessment in its entirety and include it as part of the SHSP. The division office, the Federal Highway Administration Division Office, will review the vulnerable road user safety assessment to ensure that it meets applicable requirements and approve the process consistent with the SHSP update approval process requirements. We encourage states to share the assessment with your NHTSA and FTA regional office partners as part of this process as well. And in future years, subsequent assessments will be reviewed and approved as part of the regular SHSP update approval process. So I know this is a lot of information, but it's very important to make sure states are able to meet the assessment requirements and the completion due date. While there is no penalty established by Congress if a state does not complete their assessment by the due date, this is an extremely high profile requirement in the bipartisan infrastructure law. It has the attention of agency leadership executives, including the Secretary's office and Congress itself. So the FHWA Office of Safety will collect information on the assessments and report up on all the bill requirements, including the assessments, to leadership. So it's important that we make sure all the assessments are submitted on time. Congress will be asking for this information. Most importantly, if you think your state will not meet this requirement, you need to inform your Federal Highway Administration Division Office immediately, as soon as possible. So those are the guidance requirements for the schedule. Next slide, Matt. The next requirement is to use a data-driven process. So I'm going to walk through a couple slides that discuss the legislation requirements related to the content of the Vulnerable Road User Safety Assessment. States are required to perform a quantitative analysis of vulnerable road user fatalities and serious injuries. That includes both a variety of data as well as demographics of the location of the fatalities and serious injuries to identify areas as high risk to vulnerable road users. The guidance gives some examples of the types of data and methodologies that states might use in this analysis, as well as how they might define high-risk areas. Next slide. As part of the state's Highway Safety Improvement Program, separate and apart from the Vulnerable Road User Safety Assessment requirements, the state is required to have a safety data system in place with the ability to perform safety problem identification and countermeasure analysis, and to be able to differentiate the safety data for vulnerable road users from other road users. So the state should already have the data that they need to complete the vulnerable road user safety assessment, so the state can use this safety data system as well as any other data that might be appropriate to perform a quantitative analysis. States are required to use at a minimum the most recent 5-year period for which data is available. But again, this is a minimum, and states can absolutely use additional years of data, especially if appropriate, to help detect patterns. The legislation requires examples of data to include, the legislation includes examples of data to include in the analysis, such as location, roadway, functional classification, design speed, speed limit, and time of day. We also encourage states to include indicators of where vulnerable road user fatalities and serious injuries are likely to occur. So that might help be informed by volume data, land use that might be generators for walking and bicycling trips, such as major activity centers, schools, transit and bus stops. And other data that states might consider are infrastructure indicators of people walking and biking and rolling that might be sidewalks, bikeways, transit stop locations, or even worn paths that might be an indicator of where people are expected to be walking in the area. So we encourage the state to use the best available data to understand the contributing factors related to vulnerable road user fatalities and serious injuries. To do this, it might require states to partner with other agencies to obtain some of that additional data. As an example, we know American Indians and Alaskan Natives are overrepresented in pedestrian and bicycle fatalities nationwide, but states often don't have this data from tribal areas in their state safety data systems. So we recommend that states give special consideration to ensure that tribal areas are included in the data analysis, and maybe partner with public health agencies who might be able to provide additional insights on crash outcomes. Local agencies might have data on travel patterns, and transit agencies might have data on transit ridership and facility inventories. There's a wealth of information out there to consider as part of and integrate into the data analysis to have a more complete understanding of vulnerable road user safety issues. And the data can vary from state to state. Next slide. The bipartisan infrastructure law also requires states to consider the demographics of the locations of the fatalities and serious injuries as part of the data analysis. This includes race, ethnicity, income, and age. We also encourage states to consider the demographics of the people involved in the vulnerable road user fatalities and serious injuries, if that data is available. And that could include disability status as well. The results of this type of analysis will better help inform the most appropriate strategies to reach particular groups of people, or focus a public engagement effort as part of the consultation process. There are a variety of sources of demographic data available to states to use, and many of them are linked in the guidance, and they're also shown here on the slide, and we will make sure that you get a copy of the slides available. Several states have successfully integrated equity into their safety analysis, either by overlaying equity data with safety data or using equity as a risk factor in their systemic safety analysis. And several noteworthy practices in this area are highlighted in the Federal Highway Administration Roadway Safety Capability Program. We have a noteworthy practices database, and there's a link to that in the guidance as well. You can always contact your state's Federal Highway Administration Division Office for more information, and they can help facilitate getting you some of these noteworthy practices as well. Next slide. Based on the data, each state is required to identify areas of high risks to vulnerable road users. The guidance indicates that states can use their own methodology to identify these high-risk areas, or they can choose to adapt existing approaches to meet the needs, such as Vision Zero high injury network analysis, predictive safety analysis using highway safety manual methods, or systemic safety analysis. This and much more information can be found on the FHWA Office of Safety, Pedestrian and Bicycle Safety website. And that link is shown here on the slide, and we popped it into the chat box for you. There's a wealth of information on this page, so take a look at that. And the important point here is that states define what a high-risk area means to their state. That might be a geographic area, such as an MPO region or a county. That might be a specific facility that would lend itself to systemic safety analysis. It could also be that there are specific locations that have a high number of vulnerable road user fatalities and serious injuries, such as corridors or intersections. Or there might be another priority area where you know that there are vulnerable road user safety issues, such as work zones or tribal areas. So states can define high-risk areas based on the outcome of their own safety data analysis and what makes the most sense to that state. Again, check out the website for more resources and tools, and we do keep this webpage updated as new tools and resources become available. Next slide. The next requirement is related to consultation. States are required in the legislation to consult with local governments, MPOs, and regional transportation planning organizations that represent these high-risk areas to gain local perspective and knowledge of safety concerns and potential solutions. Federal Highway also encourages that states consult with institutional advocacy and community groups that represent those high-risk areas to gain a broader and more inclusive perspective. And while this is not explicitly stated in the legislation, if the high-risk area is located within a tribal area, we also recommend that states engage with the tribal governments as part of the consultation. The purpose of consultation is to gain local perspective and knowledge of safety concerns and potential solutions to improve safety for people that walk, bike, and roll in these high-risk areas. These stakeholders, local governments, tribal governments, and other institutional advocacy and community groups often have firsthand knowledge of the challenges and barriers to walking, biking, and rolling in their own communities. And they also have potential insights for solutions to help reduce vulnerable road user serious injuries and fatalities. So we encourage states to establish a process for this consultation so that it is applied consistently across all of the identified high-risk areas. States may also leverage consultation efforts that occur as part of the existing strategic highway safety consultation process, if that's appropriate. Road safety audits are a great example to engage local governments in the community as part of the review efforts. There are many different examples of engagement techniques to gather input from local governments and stakeholders, as outlined in the guidance on practices for meaningful public engagement in the transportation decision-making document published by OST earlier this month. This is also included on the website link that we provided. These techniques include charrettes, focus groups, open houses, surveys, and workshops. And there's many more. Next slide. The last requirement for the vulnerable road user safety assessment is that states are required to include a program of projects or strategies to reduce safety risks to vulnerable road users in those areas identified as high risk, both considering the outcomes of the consultation efforts as well as the safe system approach. Therefore, a program of projects or strategies for the vulnerable road user safety assessment should take into consideration all road users, all modes of travel, as well as all elements of the safe system approach. Not just safe roads and safe speeds, which is what we do tend to focus on as part of our efforts, but also on safe vehicles, safe road users, and post-crash care. Remember, this assessment is included as part of the SHSP, and that the SHSP is a multidisciplinary, comprehensive plan. So we want to make sure that the vulnerable road user safety assessment is as well. An important point to note is that the legislation specifically states the program of projects may not degrade transportation system access for vulnerable road users. So in other words, the program of projects cannot remove access to make it safer for vulnerable road users. As states develop their program of projects and strategies, the guidance also encourages them to consider complete streets, ADA transition plans, access to transit, and our proven safety countermeasures. Each of these points is addressed in more detail in the guidance. I do want to mention that we don't expect states to have a fully developed project for each identified high-risk area. This is a planning document and included as part of the SHSP, which will be updated at least every 5 years. So it's expected that it will take an additional effort to further develop projects identified in the assessment for implementation. Next slide. Next, we'll touch briefly on potential funding opportunities. States can use a variety of funding sources to both develop the assessment and implement the resulting projects and strategies. States can use HSIP and state planning and research funds to develop the vulnerable road user safety assessment, as well as implement the resulting projects and strategies that come out of the assessment. The recently updated bicycle and pedestrian funding table is an excellent resource and includes a detailed listing of potential funding sources for various activities, including from other sources such as FTA and OST and NHTSA, not just FHWA. So make sure you bookmark that page and take a look at it. It's got a wealth of great information and funding suggestions. The link is shown here on the slide, but it's also been popped into the chat box as well. Thank you, Matt. Next slide. The last part of the guidance speaks to the relationship of the vulnerable road user safety assessment to other HSIP activities. We've heard a lot of questions from states about how this new requirement for states to complete a vulnerable road user safety assessment relates to other related activities. And so we want to make sure to clarify the relationship between existing strategic highway safety plans and related action plans, the HSIP implementation plans and the annual report, as well as other local road safety plans in the guidance. So obviously you all know about the strategic highway safety plan. Every state has a strategic highway safety plan. And as part of that plan, many states also have emphasis areas related to vulnerable road users. It might not include all the categories of individuals that are considered a vulnerable road user under the HSIP definition that Tamara talked about earlier, but they might, for example, have a pedestrian emphasis area or a bicycle emphasis area or a non-motorized emphasis area. And those states may also have developed a separate action plan to support implementation of the strategic highway safety plan strategies related to the vulnerable road users in those emphasis areas. States that are Federal Highway Administration pedestrian and bicycle focus states may already have an existing pedestrian safety action plan. These plans may serve as the vulnerable road user safety assessment only if it meets all of the requirements under the legislation. They might not fully meet the requirements now, but they can make adjustments and modifications to meet the requirements of the assessment and have the emphasis area action plan serve as the assessment if that makes more sense to the state, rather than having a separate action plan and separate vulnerable road user safety assessment. Again, you can use those existing plans only if all the legislative requirements are met. And sometimes, in most cases, we imagine some adjustments and modifications might need to take place in order to have all the legislation requirements included. Now, for HSIP implementation plans, states that do not meet or make significant progress toward their safety performance targets are required to develop an implementation plan, which is a look-ahead document that describes how the state will achieve their safety performance targets and long-term safety outcomes in the future. If a state plans to use HSIP funds for any of the projects or strategies identified in their vulnerable road user safety assessment, those projects and strategies must be included in the HSIP implementation plan. Similar for the HSIP annual report, this is a look back at the state's progress implementing HSIP projects over the past year, as well as the effectiveness of those previously implemented projects. So any project from the vulnerable road user safety assessment that did use HSIP funds must also be reflected in the state's subsequent year's HSIP annual report. And lastly, I want to mention local safety plans, which come in all shapes and sizes. They might include a local or tribal road safety plan, which is one of our FHWA proven safety countermeasures. It might be a complete streets plan or a pedestrian and bicycle master plan. It might also be a comprehensive safety action plan that an agency developed under the Safe Streets and Roads for All program. Any of these plans might address safety or facilities in the high-risk areas that were identified by the state and should be considered as part of the consultation required for areas identified as high risks to vulnerable road users. So if your state identified a high-risk area and that area has one of these particular plans, that should be considered as part of the consultation. And they may have already identified safety projects or strategies to improve vulnerable road user safety that you can include. Alternatively, if that local agency in a high-risk area does not have a local road safety plan, that could be one of the potential strategies that is considered and identified. Next slide. Lastly, the guidance also includes a template for the vulnerable road user safety assessment as an attachment to the guidance. States are encouraged to use this template to ensure that all the requirements are met and that they are providing all the information necessary for the Federal Highway Administration Division Office to approve the assessment process as part of the Strategic Highway Safety Plan process approval. States can absolutely include additional information to reflect vulnerable road user safety needs and solutions, but the template outlines the minimum information that should be included in the assessment. Next slide. So that concludes the overview of the vulnerable road user safety assessment guidance. As a reminder, the guidance is now available on the HSIP website under legislation and guidance, and it's also posted on the Bipartisan Infrastructure Law website. The Federal Highway Administration Division Office will be taking an active role in having an ongoing conversation with your state partners about the assessment, as well as the investments in vulnerable road user safety, sharing the published guidance, offering technical assistance that is available through our office. Tamara is a good go-to person to inquire about technical assistance. And the division offices will be involved in approving the process when the state completes the assessment. So please reach out directly to your FHWA division office for additional information after today's webinar. They can also provide additional presentations on this very subject to your state and safety stakeholders if that is something that is needed. And to answer any questions you may have or to facilitate any requests for technical assistance, please contact your division office and they can coordinate through Tamara. A copy of the slides, again, should be available in the chat box. We'll be sharing them along with a recording of today's webinar as follow-up. In addition, we are looking to hopefully host another technical type webinar, likely in February, that features some noteworthy practices and examples that some states may have taken on similar action plans already. So keep an eye out for that. With that, I'm going to turn it back over to Matt to give us some instruction on what happens next.
All right, thanks, Kelly. I'll get that PDF copy of the presentation in the chat in just a moment. But right now, we're going to pivot. We have some time set aside for a Q&A session. And there are two ways you can take part in this. If you look at the bottom of your Zoom window, you'll see a couple buttons. One will say Q&A. Click on that, the text-based Q&A tool will pop up and you can go ahead and type in your question, and we already have some coming in. If you'd prefer to speak on mic, you can click the raise hand button and we will reach out and allow you to temporarily unmute your mic and ask your question. We do ask that you keep any questions or comments civil, relevant, and respectful. And with that, I think we can jump right in. We've got Jerry from the FHWA with us today. How are you doing, Jerry?
Good, Matt. Good to see everyone.
Yep. I think we can just go right ahead and dive into some of these questions. First one comes from Jamie Alshire. State DOTs are already constrained, same as all other industries, for personnel, time, and resources. What other elements of the HSIP, such as MIRE, Meyer Inventory, or project listings for the annual report, are being reduced to allow for the increased burden of completing and maintaining the VRU safety assessment?
Yeah, thanks, Jamie and Jaime, and I'll let Kelly and Tamara jump in if they want to. I think as we sort of said at the beginning of the presentation, Congress really put this in there because they've seen that stark increase in pedestrian fatalities and bicyclist fatalities, and really wanted us to concentrate on the VRU issue. I think that's a big piece of that. Certainly, as Kelly mentioned, the HSIP funds do allow you to bring on additional assistance if you need that to help conduct your assessment. But I think that's some important things. Kelly or Tamara, anything else you'd like to add to that?
Yeah, Jerry, I concur. Congress has identified vulnerable road user fatalities are going up. It's a serious concern in our country, and they've identified this as a requirement that the states should take seriously. We recognize that it is added, burden on the states, and we are doing everything we can to provide as much guidance as possible and technical assistance to help states get through this process. We do see it as a very effective tool that will be able to hopefully make a difference in moving that needle towards zero, which is the goal that we should all embrace. We're not going to get there unless we all take this on and really use it to help us make better investment decisions.
Great. Next question comes from David Swinka. Are there potential issues with demographics of people falling under personal identifying information, PII restrictions?
Yeah, Dave, good question. The sources that we provided on the screen here in the slide deck, and a lot of the information you'll see from the Census Bureau, for example, a lot of that information has been scrubbed to a degree. You can't really reverse engineer it to get down to the person level or the street level or even the house level. They do a lot of that by census tracts for that very reason. So I don't think you'll experience that. That's something as you work with your partners, you certainly keep that in mind. But I think many of those agencies are used to sort of dealing with that PII concern and concern for privacy. So I don't anticipate that being a huge issue for you or anything. I don't know if Tamara or Kelly have any other thoughts on that one.
Nope, that's good.
All right. Let's see. Next question is from Jamie Alshire. Will the FHWA be revising the USC to expand the acceptable projects for GMatch funding to ensure that these projects do not fail for lack of local match funding?
So I think what they're getting at there is about 23 USC 120 parent C that allows 100% for special or certain safety projects. So Kelly, do you want to answer that one?
Yes. So the United States Code is legislation, and Congress is the one that can update the United States Code. Federal Highway Administration does not do that. We can provide additional technical assistance to help states on specific project types find other funding sources. There's that great tool that we put a link to in the chat box on federal funding that's available for a variety of different activities that help address vulnerable road user safety. In addition, there's a new eligibility in the bipartisan infrastructure law that allows HSIP funds to be used as the match that's required for transportation alternative projects, so program projects. So if you're interested, we suggest you contact the FHWA division office for more information on how to be eligible for that. So that's another great avenue to help meet up that match requirement.
Great, thank you so much. Next one is from Jivanjo Singh. The relationship is only with other HSIP plans. Will there be a correlation or relationship with TAMP or other state plans?
Yeah, so when they the TAMP, I think they're talking about the transportation asset management plans. And so I would say, and Kelly, jump in if you want to, the VRU safety assessment isn't really meant to be standalone. It certainly ties to our HSIP as far as reporting, but we certainly see the benefit of tying that to other management plans. That's essential, I think.
Definitely. And those other plans can help inform the assessment if they've already identified projects and strategies that do address vulnerable road user safety. So the whole point is to use them with each other and make sure that you're doing a multidisciplinary comprehensive look when you're doing the assessment.
Yeah, I'd say on the data side too, is certainly from an asset point, a lot of times we don't know where crosswalks are, for example. And so to the extent that you have that information or are working to collect that information, I think that works hand in hand with your VRU safety assessment for sure. So.
Thanks. We have a couple questions asking about the triple reporting requirement, asking why there's a need for the HSIPORT, the HSIP-IP, and the VRU assessment.
Do you want me to take that one, Kelly, or you want to answer that one?
Yeah, again, Congress sets the requirements. We implement them and provide as much information and technical assistance as we can to help states meet these requirements and also help clarify how they relate to each other. Some of them are a look forward, some of them are a look back. And the vulnerable road user assessment is an intent by Congress to really help address a dire safety need in our country.
I'll also just say that we do provide technical assistance for the HSIP program. If that was something of interest for us to look, holistically at your program to see if there's efficiencies or whatnot that might be of use, so we certainly can do that. So,
thank you both. John Kaplan, we have a relatively low number of fatal and serious injury VRU crashes. Can we expand our analysis to include other injury levels so we have a large enough data set to indicate some trends? We will likely use 7 or 10 years of data as well, rather than just 5 years.
Kelly, I think that's okay, right? I would say there's no reason not to do that, particularly if you're using a systemic analysis. We would certainly recommend a systemic analysis, particularly in that situation that you're describing, because a lot of those VRU fatalities or serious injury crashes tend to move around over time. And so using a systemic analysis where you can look at the risk factors in the situation surrounding those types of crashes is probably the most efficient and effective way that you can address VRU safety. So,
absolutely. The assessment has minimum requirements. There's nothing that prohibits you from expanding above and beyond and including more information or looking at longer periods of time of data. If that meets your state's needs, by all means, go for it.
Thank you. Derek Luer asks, does the VRWA require that we do actual outreach and public engagement as part of this document, or does it just require that the state discusses how outreach and public engagement will be done in the future and on specific projects?
Kelly, do you have thoughts on that one?
Yeah, I lost my box. It disappeared. My box of questions. Yeah, consultation is specifically required by Congress as part of the assessment. And they specifically point out that consultation with local governments, NPOs, and regional transportation planning organizations that are identified through the high-risk areas be consulted. So whether that's through a public engagement process or other means, it is required that they be consulted. In addition to institutional advocacy and community groups that may represent the high-risk populations in the areas that the state identified. We always recommend more and above and beyond that, but that is part of the requirements specifically outlined by Congress in the legislation.
Thank you, Kelly. Next question is from Juan Pava. Who will make the determination about the SHSP meeting the VRU assessment requirements?
Great question. To clarify, the Federal Highway Administration Division Office will be approving the process for the assessment consistent with the Strategic Highway Safety Plan development process approval. So it'll be very similar in lines to that. The division office will be our main contact person for that aspect of it.
All right, thank you, Kelly. Josh De Bruyn asks, can a state use SPR funding for this project and use those expenses to comply with the requirement that 15% of SPR funds be used for complete streets?
Can you repeat that one more time, Matt, please?
Sure. Can a state use SPR funding for this project and use those expenses to comply with the requirement that 15% of SPR funds be used for complete streets?
I'm not sure if I understand Dan, exactly what the question is. There is a 15% requirement for the vulnerable road user special rule. As far as SPR funds, planning and research funds can be used to develop the assessment. Absolutely. And also vulnerable road user special rule funds can be used to develop and implement projects identified in the assessment. So I'm not sure what the complete streets aspect might be. If there is a requirement for 15% of funds to be used on complete streets, I'm not aware of that requirement. Jerry, do you have any insight? Do you think what this question might be asking?
There is a requirement for some SPR funds for complete streets. I don't remember it being 15%. That it's really led by the Office of Planning, but we can get back to you on that and answer that question. That's a good question, so we can look into that.
Yeah, thanks, Josh. We'll research it more and get back to you.
All right, thank you both. Greg Frisbee says, early you mentioned the November 15th, 2024 SHSP one-year publishing deadline related to not needing to update the VRU assessment. Can you clarify how FHWA defines published? For instance, can we post our SHSP to the web? However, there can be some lag, days or weeks to actually posting. If FHWA's approval is received prior to the November 15th, 2024 date, but the SHSP were to be posted on, say, December 6th, 2024, would this meet the intent of the rule?
Unfortunately, that's a great question. It is the date that it is publicly published. So if, say, the governor signs the document in December and it takes 2 months to make the publish happen, it is the date that the assessment and the SHSP were published, is the date that we track that. So we recognize there could be a lag between when the governor signs or whoever the approving official at the state DOT signs before it's published. That does take place, but that is the requirement of the guidance, is the date that it's published, and that'll be the date that we measure it from.
Yeah, and I think too, as you get down to those dates and the process that needs to happen there, certainly work with your division office so that they're aware and can help provide some input there too. So.
And Tamara just posted some information in the chat as well. So thank you for that. All right, Jay Aber asks, can you talk more about what DOT is interested in seeing related to highway workers in temporary work zones as part of this analysis?
Oh, that is a great question. So highway workers in temporary work zones within the closed work zone area are not considered vulnerable road users. It's only if a highway worker is hit by a motor vehicle accident outside of or as part of traveling through the work zone, if that would be considered a vulnerable road user. And again, you can contact your division office if you have very specific, this doesn't happen very often, so please contact your division office if you have very specific data type questions so that we can make sure that we get you the very specific information to answer the type of scenario that you're asking about.
Great, thank you, Kelly. Next question comes from Carlos Sun. I assume that Federal Highway would view it as positive an effort to incorporate hospital data that might capture those VRU incidents that are not reported in the police crash reports. Do you have any insights on how to handle HIPAA restrictions?
Another great question. Personal identifying information is not required as part of a data analysis. So removing any aspect that is under the HIPAA restrictions is certainly acceptable as far as coordinating with other agencies that might have data that could help populate, and hospital data is one of those types of data.
Yeah, I'll just add, Carlos, that's a great point. Certainly a lot of our VRU crashes are underreported as far as crash reports. So working with hospital data to, getting access to that to do a better analysis is certainly a great idea. I'd certainly work with your state agencies. Usually the Department of Public Health and maybe even layers below are involved in the SHSP process. There's also a traffic records coordinating committee that each state has that usually there's EMS data and hospital data that are a part of that as well. And so it certainly there are states and agencies that have had success in that. So it can be done. So I guess working with your division office if there's questions there. So.
Thank you, Kelly. Thank you, Jerry. I just want to remind folks that we do have the raise hands tool available. If you prefer to ask a question on mic, click the raise hand button and we can allow you to temporarily unmute and ask your question. No raised hands right now though, so we'll go back into the typed questions. Let me see here. I'm going to try to make sure we get questions from folks who haven't had a chance to ask one yet. We're going to go to Shannon, asking, can HSIP funds be used to compensate vulnerable road users who participate in the assessment development process? It feels exploitive of already overburdened people.
If you're talking about a stipend for participating in a consultation process, it's not part of what the funds are eligible to be used for. There maybe some state sources you could go to help if someone far-reaching in a state wants to attend and needs some travel assistance, but HSIP funds are not eligible for that type of activity in the development of the assessment or the SHSP.
All right, thank you very much, Kelly. Jason Hershock asks, how much of the HSIP funds can be used for right-of-way acquisition? To build trails, sidewalks, etc. will require a lot of right-of-way. This is a necessary issue to address.
Great question. HSIP funds can be used for the planning, design, and construction of highway safety improvement projects. You can work with the state DOT on identifying what aspects of right-of-way are required in order to successfully implement a construction project, and all of those are eligible under the identified highway safety improvement program project. As long as it meets the state DOT program requirements and it's based on a data-driven process and consistent with the SHSP, right-of-way acquisition is an eligible activity under the HSIP program.
Thank you, Kelly. I have a question from Ted English saying, we just updated our SHSP this year. It has a section dedicated to VRU, including strategies and action plans. Will the division office help us determine if anything needs to be added to meet this assessment requirement?
Kelly, I would say the answer to that one is yes, right? So they'll certainly work with your division office. If we can be of assistance too, we can work through the division office, but it sounds like you're on the right step and your SHSP is very timely. So.
All right, thank you both. Okay, Vita asks, is the vulnerable road user special rule funds separate from HSIP funds? What is the relationship? Also, can the 15% requirement be spent using other funds outside of HSIP funds?
Great question. This is actually separate from the vulnerable road user safety assessment. There is a vulnerable road user safety special rule that requires if a state has 15% or more of their fatalities that are made up, if vulnerable road users make up more than 15% of a state's overall fatalities, they're required to spend 15% of their HSIP program funds on vulnerable road users. Oh, the question jumped away. It is eligible, special rule funds are eligible to be used for projects and strategies that are identified in the assessment, but they are separate requirements. And I'm sorry, I don't remember the rest of the question.
Sorry, Kelly, I'm not trying to manage all these questions. It's great to have so much participation from our attendees. The full question was, is the vulnerable road user special rule fund separate from HSIP funds? What is the relationship? Also, can the 15% requirement be spent using other funds outside of HSIP funds?
And then also, in addition to what I already mentioned, the special rule funds are actually underneath the umbrella of the HSIP program. So if a state triggers the vulnerable road user special rule, the special rule funds are set aside underneath and from their HSIP program. So they are related, they're not separate. And then the vulnerable road user special rule funds do need to be used on vulnerable road user safety projects. That 15% must be made. If you want to spend, if a state wants to spend more than 15%, there are other funds that are available for vulnerable road user safety projects that can be used. Other HSIP funds, and then again, that funding list has a lot of sources to get safety improvements done for vulnerable road users. I hope that helped answer the question. But again, ask your division office if there's anything else that you have more questions about or need further information on after today's webinar.
Thank you, Kelly. Jivanjot Singh asks, HSIP funds are only 3% of the total formula funding, and we are now opening them up as a match. How does FHWA envision to reduce FSI if most of the HSIP funds are moved towards planning and match funds?
So I would preface the answer to this question by saying any project, including a match for the Transportation Alternative Program, still has to be identified as an eligible activity under the Highway Safety Improvement Program, which means it has to be identified through a data-driven process, be consistent with a strategic highway safety plan, and reduce fatalities and serious injuries. So we don't envision that huge sections of a state's program be transferred to match the TAP program. But if there is an identified project that's eligible under both programs and that meets the state's needs, we recommend you work with the state DOT and the division office to facilitate how that might be an added resource or tool to use to help fund a project.
Great. Well, we have a couple raised hands coming in now. I'm going to go out first to Carla Anderson. Carla, I will let you turn on your mic, unmute, and ask your question or make your comment. We do ask that you keep things brief, civil, and relevant. We have a lot of folks participating. But Carla, go ahead. You should be able to unmute when you're ready.
All right. It took me a bit to find the mic. A quick question related to what was just asked is, so if we use the the HSIP funds for vulnerable road user matches to like our TA projects, are we then going to need to evaluate all the TA projects for how effective they are, like we do our HSEP projects?
Yeah, if you're using a, that's a great question. If you're using a match from the HSIP for a Transportation Alternative Program project, we would ask that you identify that in your HSIP annual report. And if you can evaluate that, that would be a great addition to the annual report, if that's what you're mentioning. The evaluation requirement for HSIP. Yes.
Yes, thank you.
Thank you very much, Carla. We have another raised hand from Jamie Alshire. Jamie, go ahead. You should be able to unmute when ready.
Hi, thanks so much. I appreciate it. I'm actually asking for clarification. Kelly, did I hear you say, did I hear correctly that HSIP funds are eligible to be used for design costs as well as right-of-way purchases, or they are not?
Those are eligible activities for an HSIP project as long as the HSIP project meets the state's program requirements and is identified through a data-driven process and is consistent with the strategic highway safety plan.
So
the design and development of a project is part of the preliminary engineering that can be funded from HSIP funds.
Okay, thank you.
Thank you very much, Jamie.
Matt, do you want to pivot back to, I think Derek and Elizabeth or Beth Wemple asked questions about the outreach again?
Yep, let me find Derek's original question here. So Derek was asking, does the VRUA require that we do actual outreach and public engagement as part of this document, or does it just require that the state discuss how outreach and public engagement will be done in the future and on specific projects? And then Elizabeth was looking for clarification, asking if outreach needs to be conducted as part of the development or if it can be a plan for after the VRU is completed. And I will throw out to, oh, sorry, go ahead. Elizabeth or Derek, if you want to raise your hand and unmute, we can certainly, let you chime in that way, but didn't mean to cut you off there, Kelly.
Yeah, no problem. Yeah, great, great question for clarification. Congress does require the consultation be done as development for the assessment. So not identified as a strategy afterwards, but included as part of the development of the assessment.
Okay, hope that clarifies things, and feel free to raise your hand and chime in if you still need further clarification on that. We have a raised hand from John Kaplan, and John, before I let you go, I just want to remind folks that we have about 200 people in here. We're going to do our best to get to all of our questions and raised hands, but we might have to reach out later to some of the folks who've chimed in. But John, go ahead. Please keep your comments or question brief, civil, and relevant, and you should be able to unmute when you're ready.
Great, thank you. So looking at the guidance, there is a section on implementation that says FHWA expects state and local governments to use the VRU assessment findings and recommendations to adjust project selection criteria and make other changes to guide investments. I guess what I'm looking for there is some clarification. That sounds very holistic. So sounds like that is across like other programs, not just HSIP, or that's basically my question.
Yes, John, and that would be similar to how the intent for the Strategic Highway Safety Plan is to be used to help inform investment decision-making across all types of programs and safety-related projects, and even those funded with other sources. So yes, that is the holistic approach and intent of that statement.
Yeah, I'll just add that HSIP is probably about 6% of the total federal funding, transportation funds that a state receives. And so if we were only to use the 6%, we would never make a substantial decrease in our traffic fatalities. So.
Yeah, the intent is to try and address safety in all aspects of everything we do. If we really want to try and save lives, we can't just depend on the Highway Safety Improvement Program for that.
All right, thank you for the question, John.
Yeah, thank you.
And we did have I think it was Sally Gunn added some information about what we were talking about with the SPR requirement for states and MPOs. They are required to spend 2.5% of their funding on complete streets. And so I think there would be some opportunities to have that mesh with your VRU safety assessment. Certainly, some of these projects, the ideal solution may be a complete street type project. So it's something we certainly could work with.
Great. Thank you, Jerry. Let's see. Next question comes from Jay Aber. A highway worker on foot in a work zone is specifically identified as a vulnerable road user in the guidance memorandum definitions. This is why I asked my question about highway workers. It sounds like the intention is not to provide strategies and recommendations for temporary traffic control and work zones as part of this analysis.
I would add, if the state wants, identifies through its data analysis that is a high-risk area, then yes, those could be projects and strategies for that particular high-risk area that can be included in the assessment.
Thank you, Kelly. Next question is from Juan Pava. Should states incorporate the HSP/NHTSA programs into the VRU assessment process?
As part of the consultation process, if those elements, if there are elements of those programs that address vulnerable road user safety and that could help inform through the consultation process the assessment, then yes, it's very likely that you could include those aspects, similar to the strategic highway safety plan consultation process. We always recommend including your NHTSA regional partners in those development of those emphasis areas, as well as the vulnerable road user safety assessment.
All right, thank you. Next question is from John Michael Walker. A system was referenced that is required to not only analyze the data, but also make countermeasure recommendations. Can you further elaborate on the requirements of that system? What if a state does not have some sort of system that makes such recommendations? Is the state then not able to meet the requirements of the assessment?
So, Michael, I think that's a good question. I think when we talk about system, we're really talking about that process that the DOT would have, that internal process that they would go through to first analyze the data to learn what the issues are, and then come up with reasonable solutions to those issues and strategies and countermeasures. So if you weren't able to do that, that probably would be a deficiency, but I think you can. It doesn't mean you have to have an expert system or computer software program to do that for you.
Okay, thank you, Jerry. We have a raised hand. Before I get to you, Jamie, I just want to read in one comment from Jivanjot Singh. HSIP planning efforts include safety targets, annual safety report, HSIP implementation plan, location identification efforts, data management, and now the VRU assessment. This could take up to 30 to 40% of HSIP funding. And that's just meant as a comment, not a question.
I don't know that I agree with that. There are limitations actually on how much you could spend for the planning efforts. So, but we could talk offline.
Okay, thank you, Jerry. All right, Jamie Alshar has a hand raised again. Jamie, whenever you are ready, go ahead.
Hi, thank you again, Matt. I appreciate it. Our group specifically works to incorporate in all of our, not just our HSIP projects, but all of our projects statewide. Our design division focuses on including safety elements for everybody, but including vulnerable road users. How can we, or does the FHWA recommend we account for those elements of larger projects when we're completing this VRU assessment?
Jamie, are you talking about funding or just the effort of identifying projects and strategies?
Funding, I think, would come in on our accountant's side or on our program management side, but accounting for those projects and strategies that are being incorporated as part of a larger effort. For example, if we are including a pedestrian bridge as part of an interchange design or something along those lines.
Absolutely. Those are great sources of things that can help inform development of the vulnerable road user safety assessment. You can include them as part of the consultation process or as part of utilizing and building relationships with other plans and efforts that are currently out there to help populate your assessment. There's a whole host of sources that you might be able to go to that have already looked at problems and identified potential solutions that could address the high-risk areas that are identified through the assessment. So we encourage those to be included, yes.
Yeah, I just add too, if you have an opportunity like that, if it's been identified as an issue and you have some other projects going on, by all means, try to incorporate that as part of that project. There's no requirement that you have to spend HSIP funds on these issues that have been identified. In fact, it's really the opposite. We expect you to spend any funds to address those projects. So it just happens to fit under the HSIP program.
This entire new set of guidance assumes that states are not already working to address their vulnerable road user population, but Texas has certainly been working on it for some time.
Absolutely. Yep.
All right. Thank you. Next question is from Sally Gunn. For ped and bike VU safety improvements, does BC need to be calculated? If so, please provide guidance. Thanks.
So I would assume we're talking here about if you had some projects that were identified that you were going to use HSIP funds for, would there be a benefit cost analysis that would have to be calculated? Is that the question? Kelly, I think
so.
as we get into that, it talks about effectiveness of the projects, right? So it doesn't necessarily have to be BC, I don't think, but you would have some sort of way to maximize the effectiveness of the program and use a data-driven process. So.
All right, thank you. Jason Hershock asks, can the HSIP funds be used for hotel conference rooms and catering for the local outreach process?
So Jason, that gets into the federal funding requirements. So I can almost guarantee the food is going to be a problem, potentially the conference room, but you would definitely want to work with the division office on what is allowed.
All right, thank you for the question, Jason. Jessica Downing asks, can information gleaned from recently completed engagement efforts be counted towards consultation for the VRUA? For example, can consultation that is conducted as part of the HSIP implementation plan, HSHP, LRSPs, be included as part of the summary of consultation?
I think so. I think you can work with your division office on that as part of identifying a comprehensive process to include the consultation. Now, again, consultation should also be included on the identified high-risk areas that the state's quantitative data analysis has identified and addressing vulnerable road user safety. So absolutely, those other efforts can help inform, but don't isolate to just those efforts. Make sure you're including the relevant stakeholders and agencies in the high-risk areas that were identified through the data process so that you can make sure that you're looking at a comprehensive look of what might inform the development of the projects and strategies. Great question, though.
All right, thank you, Jessica. And I'm sorry, Jerry, we got a little clarification from Sally Gunn that yes, she was referring to, say, a connection to a trail on that last question. So thanks for typing that in, Sally.
Yeah, thanks, Sally.
Derek Lure asks, if consultation and engagement is required for this VRUA, how can we determine how much is adequate, or how much should we plan to engage our partners in this document?
Derek, I'm going to give you the old federal answer that it depends, right? I think adequate, you probably don't want us to define that, but I think you know what is really adequate, right? What does the job? It's got to be meaningful consultation, and so you know, I see a thumbs up.
All right. Well, at this time, it looks like we've made it through all of our typed questions in the Q&A. We can give folks another opportunity to go ahead and raise their hands if they have any last comments or questions. And I'm not seeing any raised hands. So unless anybody has any closing thoughts, Jerry, Kelly, are we all set to go ahead and wrap things up for today? Great.
So. I just say thank you for your participation. You know, as questions come in, certainly work with your division offices. You know, we're again, this is all about saving lives. So we appreciate your time and please stay tuned. Good luck.
Thanks, everybody. We don't always get applause reactions in these, so thank you so much. Thank you for the great participation and great turnout. And everybody have a great rest of your afternoon. Thanks so much.